well, I don't know what sort of neck cancer I've got. All I know it was found to be initially in the ileum, and I since have learned that it's progressed to tumours in my clavicle, sternum, liver, and of course the main one close to the descending aorta. And there may be others now as well. When I first went to hospital, I went to Middlemore Hospital with severe pains in my belly area, and I wasn't too worried about it because, well, I was worried about it, but my family history has a gallbladder. So I thought perhaps it was about my age that happened. So I wasn't worrying about it. So I got quite a shock when 10 people arrived at my bedside and pulled the curtain around. There were 4 other patients in the ward. And all these 10 people crowded in behind the curtain. And then the guy said, Mr. Clapham, he said, you've got either, I think he said Hodgkin's lymphoma, non-Hodgkin's lymphoma, or carcinoid cancer, but we don't know what. But either way, it looks like you may not leave here alive, which was quite a shock to me, really. And then they all sort of looked serious, and then they all filed out. And so, yes, it probably would have been better if you'd have been in a separate room where you could have been told this. And also, it would have been better if you could have had someone with you, i.e. my wife and that, you know. So, but I guess being a Middlemore Hospital is very much a teaching hospital. I guess that is why they decided to do that. Anyway, I went and asked the desk if I could have a room, and they looked at me blankly. And finally, when my wife was due to come, they cleared out our nurse's room, so my wife and my son could be told by me that this might be the last time they were going to see me because of what he said. So that was a bit sort of gobsmacking. But you know me, I'm pretty realistic and down to earth, but it certainly was difficult for my wife, I'm sure. And I know my son was quite distraught. We got over that, and then the next thing that happened is I saw a surgeon come in, and he went away. He was going to operate on me. And it was a full laparotomy the first time, and it was done by a lady surgeon who took over from the main surgeon who was going to India for a holiday. And he was he actually insisted that he do the surgery, but she decided that since he'd gone, she'd take over and do it, rather than leave me waiting for 3 weeks. Yeah. And I sort of got the impression they were sort of competing to do it. But anyway, about a year later, he had a second attempt, and he and another young surgeon attacked my body with another full laparotomy. And at that stage, they said that there is no way that they could save me by surgery because my neck cancer was up against the descending aorta, or words to that effect. And one neck and I'd be dead, so they decided to let me live for as long as I could. And that there were, I think, 13 or 14 net tumours that she took out from the ileum. So that was that. As for the different treatments I had, well, the first real treatments were huge big needles in my bottom. And I've forgotten the name of my secretary's just stuck her head in the door and said it was octreotide. All I know is that the octreotide injections were quite big, and my GP, who was my GP for 47 years, was brilliant at administering them. And one lady in the practice was also brilliant, but the rest were terrible. So I would go to get my octreotide injection in great fear. 9 times out of 10, the fear wasn't realised. On the other time, it was hard to sit down for a week. But anyway, that treatment made me feel a lot better, no doubt about that. And I know it cost the government a lot of money. I think somewhere I heard that the injection cost was about $3,000 odd per shot. And I'm so grateful that this is New Zealand. So yes, it did help me with symptoms such as flushing and how I felt. And I guess the treatment with cancer is mostly designed to try and get you to feel normal as possible and able to do the things in life that you like doing. So one of the things that I did have for treatment is I went twice for peptide receptor radionuclide therapy, or PRT as it's known, PRRT. And the treatment, frankly, is nothing, providing you get home in the first day or two. It starts to hit you after that, and unfortunately with my case, I'm a little different. I finish up with severe inflammation. I'm not sure what that quite means. I felt pretty lousy. In fact, according to one of my doctors, I could well have died, but nobody told me that at the time. I probably would have ignored it anyway. I guess I always have thought about it. I thought about, well, just how long will it be? But then when I went to unicorn meetings, I met people that had done many years. So I thought that could be me. I didn't know, but you always think about it, and I'm a person of faith. I'm in the Catholic faith, and I'm not worried about dying. I'm more worried about how I'm going to die. And it's always a great relief for me in these days recently when morphine, or the oxynorm, oxycodone that I'm taking works and I get back to normal. I've been told 2 prognoses. One was at the start and one was not so long ago. And I can't remember whether I asked for the prognosis at the not so long ago one from the doctor. But he volunteered that and told me that I would be most probably dead before Christmas, and that was with 5 weeks to go to Christmas. And that was a huge shock, and that's been now 7 to 8 months ago. So he's human, and I must be a weed because you can't kill weeds. That prognosis was made by the doctor at the time. Was probably because of my red blood cell uptake or downtake. I think I was losing red blood cells to the extent that I had to have 7 bags of blood, not all at once, 4 initially, and then 2 lots later, or 2 in 1 bag. And since that, my red blood cells have been varying but gradually going up. And I've been kidding myself that I'm helping it by taking, before my blood test, liver as a meal. And interestingly, when I don't take liver as a meal, my blood cell count goes down. As regards the good and the bad and the ugly, well, the good is having people that you know to call on, people like you, Avril, people like Ben and my own doctor, the government insisting on no more than 3 months for a prescription. It's not too bad when it comes to the octreotide, but for things like oxynorm and oxycontin, every 10 days I've got to go to the chemist, or my wife goes now, and the chemist is away a round trip of about 50 kilometres, and every 3 10-day intervals I've got to apply again for more, and that costs $25 every application. So that's expensive. Plus, but I guess it's just something to do with drug addiction and so on. Do I have any advice for NET patients just starting out on their journey? Well, stick with it. To be honest with you, one hears dreadful things about cancer. Now, I have been fortunate to come from a family where cancer has never before played a part in my genetic side of my family. Every one of my immediate whānau family have died of heart attacks, and usually well before my age. So, I mean, I've had uncles and aunts and things die in their 50s and early 60s, and my parents both died in their early 60s. The tips that I would suggest to people is please take every opportunity you can to go to unicorn meetings, even though you feel you might have heard it all before. Every time I went, I found something new. I think today's patients will probably be the last to get NET cancer, and I think it will be cured by genetic manipulation, gene manipulation therapy, and that's what's looking at. But in New Zealand and Australia, we're streets ahead of America.